Assalamualaikum and a very good morning, ladies and gentlemen, distinguished guests and speakers. I see a lot of students, intern of PA. It's glad to see young generation, young minds with young blood, right, to steer the PA profession in India further to the next generation. Thank you so much. Just want to express my gratitude to Madam Gomati as the president of IPA for inviting me to deliver not a speech basically, but rather experience from Malaysia. It's where I came from. So entitled, it's a bit mouthful, my topic, but nevertheless, just bear with me. It's a very short talk on the evolution and impact of medical assistance in Malaysia, enhancing healthcare delivery through specialized skills and collaborative care. Well, I am a practitioner back in Malaysia for the past 15 years with the Ministry of Health, and 5 years journey on as an academician, a faculty member with Open University Malaysia. We recently had a conference back in Malaysia just a month ago, a couple of weeks back. It's the first Malaysian paramedical conference, which was held on the 27th to 29th of September. So basically, as you know, that according to the International Standard of Classification of Occupation, or ISCO, under International Labour Organizations, we are actually labeled as paramedical practitioners. So moving forward in Malaysia, we are probably to change again our name, as we felt that the word assistant attached to the word medical assistant can be a little bit of troublesome to us, as many of the professions like doctors and nurses view us as just a part of assistant. So we would like to, not to say remove, but rather would like to transform our name to in line with the International Labour Organization name as paramedical practitioners. So this conference was actually to preview, to set a preview for our practitioners back in Malaysia, that this is our coming changes that we are about to do. First, to change our name, and then number two, to change the existing Practice Act into Paramedical Practitioner Act 2024, which we hope that it will be approved by the Parliament by next year. Then we will have a new name. So just pray for us. So at the same time, this event is actually to boost the morale of our medical assistants back in Malaysia. So we have actually came out with a reference resolution whereby we need to emphasize the importance of recognition, number one. Number two, competency as a practitioner, clinician practitioners, as well as the autonomy, to be able to practice, stand alone as a professional, not working under a physician or doctors, but working alongside with the medical professionals. That is our main target. So our profession basically spanned a very long journey, about 230 years back then, during the British, colonial era. So in fact, we have two medical assistants who were trained in Madras Medical College. So I think I came to the right place to I love history basically. So to know that this is where the two origin of medical assistants were learning and gained their diploma in Madras Medical College, it definitely gives a whole heart of inspiring moment at the time. So we started off in 1786. It's almost 240 years our profession span, and we work. Those days they work in various states in Malaya, which we will call then. They were sub-assistant surgeon. They were called apothecaries, and then they were called dressers. So those days they provide simple basic primary health care as well as tertiary cares to the patients back in those days. And then we have a little bit of change of name to hospital assistants in 1960s. And then thereafter, after 2 decades, we changed our name to medical assistants, MA. So, and then last, we had a name change again, which is assistant medical officers, or AMOs. So we are called AMOs administratively, but our act is still called Medical Assistant Act. Currently, we have about 29,000 plus over registered medical assistants with the Medical Assistant Council, or we call it Board of Medical Assistants. So we have about 23,000, about 81% of the practitioners based in the Ministry of Health facilities, the hospitals and primary healthcare clinics. So the majority of the practitioners are from the government service. And the rest is private sectors, both hospitals and clinics, general practitioners, as well as industries, for example, oil and gas and other industrialized companies. Let's look at the area of practice in Malaysia. So as I mentioned earlier, the majority of our medical assistants work with government. They are government employees. So primary healthcare contributes about 36.9%. So we have a bulk of medical assistants who practice medicines in the primary healthcare settings. So majority of them are in primary healthcare settings, working in a rural area, in a suburban area, as well as other small district areas, right? And the remainder of 31% are in the emergency department, in emergency medicines, and the rest are other specialties and discipline. So the MAs, basically, majority of them are in primary healthcare, as well as in emergency medicine settings. So the primary function of medical assistants, we are basically mid-level practitioners, as you have highlighted as well. In PA in India, they're called mid-level practitioners, where we work with specialties like pre-hospital care. We provide ambulance services. We do testing, screenings for diagnostic purposes, handling of medical equipment for treatment purposes like ventilators, treating cases within the prescribed scope. So in Malaysia, we are allowed to see cases and we are allowed to prescribe medications, but certain medications are allowed for MAs to prescribe. We have lists of cases that can be seen by an MA, and if the case is beyond our jurisdiction or our practice, then we refer to a physician or a medical officer. And of course, management of public health programs. We have a lot of public health programs, mainly to prevent disease, as well as to promote healthy lifestyle to the public. So that's the main core of medical assistance in Malaysia. On regards to education and training of AMOs, currently we have about 7 institutions by the Ministry of Health providing basic diploma level courses, which we call Diploma of Medical and Health Sciences. It's a 3-year course, and it's fully sponsored by Ministry of Health. So I'm the product of Ministry of Health, undergoing 3 year program during my diploma time. And of course, because of the advancement of technology, medical experiments, as well as number of patients are increasing, we do have insufficiency of medical doctors. So hence in 2007, there are about 13 private colleges were granted permission to offer a 3 year diploma program, similar like the Ministry of Health institution. So totally we have about 20 plus 1 Armed Forces College, which they offer a 3 year program, diploma program, to the Armed Forces medical personnel in the medical assistant program. And since 2007, we have also 3 universities, basically, sorry, not 2, it's 3 universities offering undergraduate level program. So basically, this is 2 of the universities offer post-registration, meaning that the entry requirement is that you must have a diploma in medical assistant, 3 years, with clinical experience of 1 to 5 years. Then you can apply to do your undergraduate. So number 1, either you can do a Bachelor of Science in Science of Emergency Medicine, focusing in emergency medicine. And number 2, undergraduate program called Bachelor of Medical Health Sciences. It's a 3.5 years program, online and distance learning. So we have 2 universities offering post-registration undergraduate level, and another university offering fresh graduate with higher school certificate, entry appointment, and you will need to do a 4 year undergraduate Bachelor of Medical Health Sciences. And then after that, once you have completed both your undergraduate and diploma level, you have to sit for a license exam, which is organized by the council, Medical Assistant Council, and you have to pass this exam in order to be registered as a practitioner and to be given annual practicing certificate, which you have to renew every year, right? Okay. So basically, in Malaysia, we have few guiding principles, I call it doctrines, that we need to abide, that will definitely give us a good guidance. Number one, we have the Medical Assistant Registration Act, 1977. Soon, as I mentioned earlier, we have a new coming up legislation, which is the Paramedical Practitioner Act, 2024, which will be presented in Parliament soon and hopefully can be approved. And of course, we have other documents that can help us to ensure that the medical assistant receive the best education based on an accredited program, based on an acceptable minimum standard set by the government as well as the Ministry of Health. So we have a strategic plan, a 15 years strategic plan, which started off from 2016. And so we have about 6 or 7 years to achieve 6 pillars to ensure that the profession of medical assistants will steer forward for the next decade. And we have a short strategic plan, which runs from 2023 to 2025, looking at specific short-term measures that we can actually lay it out and probably work on it to ensure that the sustainability of the profession will remain for the next decade or so. And of course, we have few indicators, for example, the MSQH, which in Malaysia, the hospitals in Malaysia, they need to abide with these standards, quality assurance standards. So medical assistants were fortunate enough to be placed in the 25th standards. So there are total 25 quality assurance standards that the hospitals need to comply. So the medical assistant profession sits in the number 25. So in the hospitals that to ensure that medical assistants professions are being well taken care of, so the hospitals need to comply with the MSQH standards. So we were grateful for that. And of course, we have credentialing and privileging guidelines for the medical assistants. So for example, some of the specialties, they need to be credentialed and privileged, in order to perform those procedures, those invasive procedures. So we have that, we have the guidelines to ensure that MA are properly credentialed and privileged to perform those services. So this gives us the assurance as well as a sense of professionalism of our profession to the public, so that patients will see us as a profession which is in par with the medical doctors or physicians. And we have also our own standard practice guidelines, as you call those standard operating procedures. So these are clinical procedures that written by the medical assistants who are the subject matter expert for that field. So these are just some of the standard practice guidelines that I've shown to you. You can basically go to the web that I've provided, and it is open source. You can just download, and you can probably use our standard practice guideline as your guidelines for your clinical practice, right? So we have emergency medicine and trauma services, hemodialysis, the assistant medical officers, the anesthesia intensive care unit, and of course clinical neurophysiology. And we have so many actually coming up in the process, and it's written by the medical assistants who are subject matter experts. So to ensure that the standard practice is being implemented throughout the country in Malaysia. So we don't want to have substandard practice among our practitioners. So to ensure competencies, to ensure that they are well trained, we need to provide basically a standard, basic standard guide in terms of documentation to provide, because most of the MAs are working in interior side. So they might not have the opportunity to attend conferences or to attend, clinical faculty meetings. So by having this documented books, you can actually share to all these medical assistants who works in interior area to have a reference, basically. It's like a medical direction for them to teach them what to do in case of complicated cases that they encounter. And this is moving way forward, and this is what we are doing right now in Malaysia. Probably can share with you all, ladies and gentlemen. We are in the process of registering our medical assistant who are specialists in their own field. So we have a program, what we call Assistant Medical Officer Technical Expert, or short called AMOTEX. And this is to recognize advanced practitioners among AMOs. So we need to recognize these experts, those with 10, 15, or 20 years, clinical experts in their various fields. So it's time for us to register them, to allocate, as well as to recognize them as a specialist. So basically, we follow the model of doctors, physicians, where in Malaysia we registered physician and doctors with a registration number. So we are following suit what the doctors are doing, but through this MOTEX, we are doing it only for government employee for time being, since the number of the majority of the medical assistants works in government hospitals and clinics. So since 2022, we have started registering these subject matter experts or specialists of medical assistants. Because why? If you remember the strategic plan 2016 to 2030, our plan is to have 50% of the medical assistant population, they are specialists, and 50% will be generalists. So we are moving forward. We are moving forward away from 100% generalists. We want to have more medical assistant with subspecialty or super specialty. So these are numbers I can share with you up till June 2024. So far, we have registered about 1,003 medical assistants under the AMOTEX registry. And these are the 16 specialty that we have identified for the phase 1, ranging from emergency medicine, which is almost the majority of the applications, orthopedic, nephrology, neurophysiology, perfusionist, cardiology, cardiothoracic, surgery, HIV counselor in primary healthcare, wound care, diabetes management, anesthesiology and intensive care, neurosurgery, primary healthcare, psychiatry, mental health, urology, and forensic medicines. So out of the 29,000 plus medical assistants in Malaysia, almost 1,003 of them are registered and are accorded with the registration number as a technical expert in their particular field. So this is something that we are proud of, and we are achieving towards that target by 2030. Right, coming to the end of my lecture. Hopefully I'm keeping my 10 minutes time. Right? Okay. So we have actually, Malaysian had started to, embrace international collaboration. We found that our profession is 230 years, in the world, the oldest profession. So I think we need to start to embrace as well as to share our experience, our practices, in Malaysia to the world. So we have few of our medical assistants who have actually ventured out to other countries to share their experience, to get connected with a few of the various agencies overseas. So we have few of our graduates, medical assistant graduates with bachelor's degree, working with the Bahrain Royal Medical Services Ambulances Department, and of course we have few of our practitioners are currently working with the NHS under the London Ambulance Services under the NHS Trust. And of course, with the IAPAE involvement in the LOOPS project, and I think Geoffrey knows about the project, and to have one common and harmonized medical assistant or PA curriculum, so that in future, everyone can work anywhere, right, who have this profession, either PA or PA analogs, right? So, and then with the GACOPA involvement, this is where we can actually showcase and to share our expertise as well as our knowledge and practice. And to conclude my lecture as well as my sharing, I think these are the few points that I would like to highlight, and maybe the IAPA can take into consideration in the midst of journeying towards your PA profession in India. Is number one, it is essential to establish a standardized program. So you need to have a program standards or doctrines to provide clear guidance on academic, in terms of accreditation, clinical practice and competency development. So this is a long-term process itself. And of course, number two, AMOs or AMAs in my country, per se, must also adapt dynamically to the ever-changing healthcare ecosystem by staying updated with modern medical technologies. So we have the AI technologies, artificial intelligence, innovative practices, and patient care strategies. Number three, collaboration between associations, which is very important, the unions, as well as councils, is vital in championing the cause of competency, recognition, and autonomy, ensuring that this profession, okay, have a choice in shaping the future of healthcare in my country, Malaysia, of course, hopefully in India as well. To have a clear, unambiguous job description. Ladies and gentlemen, you need to have a clear job description of your work, all right? To prevent confusion among nurses or doctors, okay, in terms of what we can do and what we can't do. We are not replacing the job of doctors. We are not nurses. It must be clear in every mind of a PA profession. It must be stand clear that you need to have a clear job description and roles. Okay. Number five, we should identify and capitalize on our niche, meaning that we need to find our niche, what we are good at, what is our specialty, right? Focusing on specialized areas where their skills can be maximized. So in Malaysia, we are now focusing towards pre-hospital care and ambulance services. We don't want to trespass what the doctors are working on. We wouldn't want to trespass what nurses are doing. So we're looking at our specialized niche area, which is suitable to our function as a medical assistant back in Malaysia. So where our skills can be maximized. So by doing so, they can complement rather than compete with other healthcare professionals. We are complementary, we are not competing, all right? And ensuring a balanced and harmonious professional development. And last but not least, collaboration with international bodies is very important. So when you collaborate with international bodies, we can provide opportunities as well as knowledge sharing, best practices, and of course, strategic guidance. So by engaging with global standards, AMO can further enhance their competencies and of course, elevate the standing in the international healthcare arena. So with that, I'd like to thank the Indian Association of Physician Assistants, IPA, the assistant medical officers in Malaysia, as well as National Association of Medical Assistants, for allowing me this opportunity to give you a small talk, as well as sharing from my perspective as a practitioner back in Malaysia. So I thank you, and hope you have a productive day ahead. Thank you so much.